check with the clerk. At this juncture, I would suggest that it just be put into evidence, but they referenced and showed a photograph not in evidence.
Move to admit.
Okay, what's the number again?
25, 29, 60.
60? 60?
Yeah.
The court receives 2529-60. What's next?
We had redacted a letter to Mr. Zimmerman we were talking about before we found it, and we've redacted all reference to anything other than one in a sentence, Johns Hopkins Hospital. It's actually from Mr. Shapiro. We redacted that, and it says, please cease and desist from any and all contact or communication with Johns Hopkins All Children's Hospital and their employees. We will consider any future communication between you and their employees as a violation of Florida Bar Rule 4-4.2. It's dated December 7th, 2016. Move to admit.
We object. There's a sequence of letters that would explain what was going on before and after, including a follow-up letter from my office telling him he's welcome to come to the hospital and we're going to ensure that we comply with orders. This was never disclosed to us prior to Mr. Zimmerman testifying. They plan to use this with him. We need notice of this. So we object at this point. We would need to admit if we were going to do this. It was never admitted through the witness. So I don't know if you need to hear more argument on this, but I didn't have a chance to cross-examine him on this. I had no notice that this was coming up on exhibits that they're supposed to get us 24 hours in advance, which they didn't. So we object at this point.
This is trial exhibit 2793-001. It's been around for forever. My memory is correct.
We didn't have it.
Oh, we did not have it?
Mr. Zimmerman
How
sent
come
it
it's
to
not
us
good?
after his testimony, after
Oh.
testifying about the existence of the letter.
When? Oh, today?
Yes.
I take
That's
that
why we didn't
back.
get it
There
before
were
you.
lots of these. I thought it was a trial exhibit. We'd already disclosed it. But it's brief and it is to the point.
But a concern I have with a lawyer to a lawyer letter is you're now dealing with collateral issues that are we now going to explain what the rules of professional responsibility are? It opens up so many cans of worms that are collateral to the issue before the jury. So I'm going to sustain the objection on that ground, as well as it just apparently wasn't even provided until after.
Not
After
before
the
the witness
testimony.
testified, Judge.
Yeah,
We
we
were
knew
fully
it.
prepared for that, which seemed the intent.
And
What-
on that note, Your Honor, real briefly, I think we need a curative instruction on this too, because he applied to the jury in his testimony with no notice to us that somehow the hospital blocked him from seeing Maya.
Normally, when someone asks for a curative instruction, they hand me what they want,
Okay, we will
as opposed to
discuss
just
this.
an abstract.
I understand, Your Honor, we'll discuss it.
I'm not saying that we're going to do it or not. We really need to get in the habit of actually proffering language as opposed to
Yes, Your Honor.
just talking. Okay.
The last very brief issue before Dr. Henschke testifies, most of her records that talk about relapse deal with litigation-related stress. That's clearly not a compensable action in this. And just so I'm not jumping out of my seat, I was wondering from the plaintiffs if they're going to be arguing that, or proffering testimony through Dr. Henschke that Maya is having relapses because of the stress of the litigation, which would not be a material issue in this case or compensable.
It is, I am offering it for the purposes of demonstrating that she has relapses. The defense has contended that she was just bright, sunshiny, and smiling through the entire period of time after she left their hospital. This demonstrates and proves that the child did have a relapse. The only thing, we can look for exactly what it says. It says there was a deposition. That's all. It doesn't say anything else about it.
Can I see what we're talking about?
Sure.
Yes, sir.
Have we been provided the redacted copies yet? We still don't have a redacted copy. Well, go ahead.
This is the unredacted copy, Your Honor.
There's a whole bunch of handwritten notes on this, so I'm not.
I think it's hers.
No.
Well,
Have you shown this to Mr. Shapiro before I start looking at something that has a whole bunch of handwritten?
There's no handwritten notes on her records.
I just did.
no,
Let me look.
handwritten notes. Perhaps we can just put up one of the records. It's a trial exhibit.
Greg.
2011-16.
Yeah, here's her records. This is,
2011-16?
Correct, Your Honor.
May I see it, please?
These are redacted or unredacted?
unredacted.
And
Yeah, I'll focus you in, Your Honor.
Here.
help me out.
Yeah, so the
Make it larger.
third paragraph, patient states the trial against the hospital got pushed back and school started a month or two ago. She's struggling to focus this year. Midway through the paragraph, due to the trial being pushed back so many times, she does not have faith things will happen on time. All four notes talk about her stress level being related to litigation, and I'm honestly looking for guidance how to handle this.
So you're,
What I would ask, this is what I would ask from the plaintiff in the court, that while they can certainly ask Dr. Henschke if Maya experiencing stress has led to what she may describe as a relapse of her symptoms, that's fine. I think that's the way we can cover this. But to go into the fact that this was caused by the stress of this litigation, by defense counsel, by any things of that nature would not just be prejudicial, but it would also be, it would not be compensable.
I do not intend to make any accusations as against counsel for the litigation. It is in her file as the reason, truthfully, that she had one of the reasons she had a relapse, and the jury would be entitled to. There's nothing particularly damaging here. It's simply that this has become a stressful situation for her, and part of our case is to demonstrate a stressful situation. It's not part of the compensation. Again, what we're trying to establish here, Judge, is that she was not fine, and that her CRPS gets activated by these types of situations, by stressful situations. They can cross all they want, and I don't intend to come up and ask her a ton about, now, were they mean to you in the deposition? No. But in her records, it should remain truthful as to the reason. I will save the arguments about what actually happened and what's actually gone on in this litigation for another time. But for these purposes here, this is simply the truth. And it's not being derogatory in any way to the defense or to Johns Hopkins.
Just very, very brief response. The problem with this is it's not compensable, and I don't know how to address this without either redacting most of these records or having the court inform the jury that any stress related to the litigation process is not something the jury can award damages for.
Why are we hearing this at this time? They've had at least, when was the first time we sent the exhibit list to them?
And more importantly, we went through this morning on this exhibit, and we've been in the process of redacting, going back and forth with Ms. Crawls for the past 4.5 hours. We finally got the exhibit correct with the redactions that were discussed this morning, and now we come in here and we're blindsided with new redactions that are requested.
I
And
wasn't
they've
asking,
waived them by any stretch of the imagination.
can we just have one person talk at a time?
I'm not asking for additional redactions. I would have been happy to bring this up at 9 in the morning, but we had the jury waiting. I thought it'd be better to do it this afternoon. All of that being noted, it's just a matter of the argument that the relapses, if they're related to litigation-related stress, are not compensable. And I still do not have a copy of the redacted records to proceed on this witness.
Your tech guy
As of when, he does not have it.
does. Like I just said, Ms. Crawls and I just worked this out in the hallway over the lunch break.
Okay, but my trial technologist still does not have a copy of the redactions. So anyway.
Are you asking me for a ruling?
I am asking you for a ruling, Your Honor. I apologize for being vague. We would like a ruling that the plaintiff cannot ask this witness on the witness stand that what the cause of her stress is, and since these records are going to come into evidence, we would like the jury to be informed, and we'll draft appropriate instruction for your consideration at the appropriate time, since this is going in evidence, that litigation-related stress would not be a compensable damage to the plaintiff. But I won't ask for that in the abstract. We can draft something to that effect for your consideration.
And we vehemently oppose that, and we should not have, this is something, I don't believe that it's true, and we haven't had a chance to research it. But if there is something about, because you mentioned litigation, that it somehow becomes compensable, then that can be handled with a jury instruction.
Here's my view. I do not want there to be discussion about the trial being moved back, because I don't want to open up the issue of that amongst the jury as to, you know, what happened. Was it somebody one side's fault or the other side's fault? That's clearly not something that is in the purview of the jury. I don't see, however, how you can legitimately keep out the concept of, in a general sense, that litigation is stressful, and that Maya, obviously going through litigation, has stress associated with that. I don't see how you cannot say that. Now, I'll consider the instruction about, members of the jury, you've heard that, but understand that that piece is not compensable. I think that's the way to deal with it. But I really don't want to get into discussions, questions, Mr. Anderson, about the reason why the trial got delayed
Of course not.
last year. I just put that out there.
That's not my intent in any way. I simply want the record. There has to be some reason why she had this relapse, and that's unfortunately was the reason. So my intention is not to do that. So, the court having ruled, I would like to proffer the testimony of Jacqueline Henschke regarding the sexual abuse.
Can we do that after the jury goes home?
Yeah,
Because I've got a jury waiting.
all right, Your Honor. I'll await that. Okay.
Still no. We still need the exhibits from your technology.
Mr. Reyes, have you finished whatever redactions that were agreed to?
It's being sent here in a moment, Your Honor.
Your Honor, is now the time to hand the court 2011 in its redacted form.
Is that the one from this morning?
It is with the redactions that were corrected over the last few hours.
Be happy to give it, you can give it to the clerk. Thank you.
I was just looking at my notes, Judge. And part of my introduction is how she got involved in this. And in it, she will explain that she was contacted to be a safe harbor, and why and how she was contacted, and what the direction was to her. And that is obviously very relevant, how she came involved in this litigation. And it certainly is the truth. So I will not emphasize it, but I do want to be able to say that she was retained in connection with this litigation. And the purpose was for her to be someone that Maya could talk to.
Stop. On that issue, you suggested that. I never said that that was allowable. You seem to feel that a plaintiff is allowed to have doctors without the records being turned over when the plaintiff is making a claim. I never agreed to that. That's something that you wanted, but I never said so. I don't think you should try to make those statements or elicit that information from this doctor, because that was never agreed to by the court.
I'm unsure. I believe, Judge, the way that it went down was we presented the court with the fact that Maya Kowalski had no one to talk to, because every single time she ever had talked to anyone, the defense would subpoena the records and then depose them. And so we proposed to the court and to defense counsel that this child have a safe haven, someone she could talk to, and we pledged in return we would not use her records and we would not use her testimony if only Maya could have some place to talk. And then as time went on, the defense moved and wanted to do a subpoena ducis tecum, and that was allowed over objection. And then the defense wanted to take a deposition, which was allowed. over objection. Then, once they'd already deposed the doctor and once they made it clear that they intended to use the doctor's testimony, then I put the doctor on our list because I had to counter that.
And again, I did not make the rules with respect to what is and what is not discoverable relative to when a plaintiff makes an affirmative claim. Those have been well known. You knew them. And what you were asking was a legal impossibility. I dealt with that months and months and months ago. And I said no. And I'm saying no again. I don't know why we have to keep talking about the same issue over and over again.
I need instructions.
I'm done.
I
That
need instructions.
issue. Please don't go into that issue with this witness. Now, may I bring in the jury?
Yeah, yes, Judge, but I need to inform her not to, what she can and cannot say for a moment.
If the plaintiff wants to withdraw her, we're not going to object.
No, we're not withdrawing her.
Jury at this point?
Yep.
Bring in the jury.
Sure, is that showing?
Okay, welcome back. Members of the jury, want to confirm while you were away, please be seated. While you were away, you did not discuss this case amongst yourselves, you did not do any investigation, and you received no information. Is that correct? And that you have not seen any media coverage about this case since the last time? And that you were not approached by anyone? And your cell phones went off at 2:18. Did yours go off early? Yeah, so did mine. Okay, Mr. Anderson, call your next witness, sir.
Dr. Jacqueline Henschke.
Stand here. Or you can raise your hand.
You solemnly swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth. I do.
Right this way. Just going to have a seat about where you stand.
Okay.
Please state your name for the record.
Dr. Jacqueline Henschke.
And what is your specialty of profession?
I am an adult and child psychiatrist.
And have you been asked here to offer opinions having examined and treated Maya Kowalski during the period of 2021 and 2022?
2022 to 2023, yes.
Oh, 23, excuse me. Can you give the jury a little bit of detail about your background, training, and experience, beginning with your undergraduate degree?
Yeah, I was born and raised in Washington, D.C., and
You
went
have
to...
a very soft voice. You might want to talk to the...
I do. I was born and raised in Washington, D.C., went to Georgetown University for my undergraduate degree, spent a little time in New York bartending, and then decided to go to medical school at Tulane University in New Orleans. I decided initially to go into pediatrics. I did my intern year, which is your first year of your residency, at Miami Children's Hospital in pediatrics. And then I decided psychiatry was a little more my thing. So I transferred to George Washington University and completed my adult psychiatry residency. And after that, went to Stanford in Palo Alto, California, and completed my child psychiatry fellowship.
And then, since that time, have you been, is that where you did your residency then? Was it Stanford? Or?
Stanford was my fellowship for child psychiatry, and then the residency for adult was at George Washington University. You have to complete your adult training first, and then you do your child psychiatry training.
And so the jury understands, are you board certified?
I'm actually double board certified, so I have to be board certified in adult psychiatry, and then I had to do all the exams to get board certified in child psychiatry.
Following the completion of your schooling, can you tell the jury about where you started your practice?
Yeah. So after I completed my fellowship at Stanford, I went on to return to New Orleans post-Katrina. It was in 2009. And I was a professor there, an associate professor, and then I went on. I was hired to head the consult liaison team, which is just a fancy way of saying I was a psychiatrist that was in the hospital that all of the primary teams would call if there was an issue. If a child was depressed because they were receiving chemotherapy or the family was distressed, then I would go see them.
Before we continue on, can you tell the jury that when you went back to Tulane post-Katrina, did you see and treat victims of Katrina?
Yes.
Tell the jury primarily what the diagnoses were for those victims that had been through that.
Most of the primary diagnoses were post-traumatic stress disorder. In general, when you're a child psychiatrist, you tend to see a lot of trauma, especially if you're seeing children 6 and up.
Okay. And so, how long have you been in private practice? How long have you been practicing child and adult psychiatrist?
I've been practicing since 2005.
And the difference between a psychologist and a psychiatrist is the psychologist has a PhD and you have a medical doctor degree?
Correct.
So you can prescribe medications and so forth?
Yes, but I'm also trained in therapy in addition to prescribing medications.
All right. Can you tell the jury then, let's continue on with your experience then in hospital settings around the country?
So at Tulane, I was head of the consult liaison service. So that meant I worked primarily at Tulane Hospital. When I was at Stanford doing my training, I of course worked at the Children's Hospital at Stanford. And when I was at Miami Children's, that was a full children's hospital as well. And then I've worked in full psychiatric hospitals that are only seeing psychiatric patients.
And so, how long have you worked in and about hospitals as opposed to a private practice?
I would say in hospitals throughout my whole career. So there are times where I have done outpatient, but at the same time I will cover a hospital on the weekend to do the consults. So throughout my whole career, since 2005, I've been working in hospital settings.
And where do you live now, and then where do you practice?
I currently live in St. John's, Florida, between Jacksonville and St. Augustine. And right now I'm doing full-time telemedicine to a psychiatric hospital in Colorado. I'm licensed in Colorado and Florida.
And how does that work out? Is this telemedicine? Or?
Yes, it's full-time telemedicine. I see the kids over telemedicine, and sometimes I do see adults as well.
How many cases of PTSD and depression can you estimate that you have seen and or treated in the course of your career so far?
I would say thousands. Cases of PTSD and depression, ADHD, all of the pretty common diagnoses, schizophrenia, bipolar disorder, eating disorders.
Well, what I'd like you to do is explain a little bit about the history of PTSD and to differentiate it from other psychological psychiatric problems.
So PTSD has been known as a phenomenon since at least the Civil War. It's been documented. At that time, it was called soldier's heart. And then in World War I, it was called shell shock for soldiers returning home. World War II, battle fatigue. It was also called war neurosis. But in 1980 is when PTSD officially entered our Diagnostic and Statistical Manual. That's the manual we use to make diagnoses. And in 1980, there was a big shift from just making diagnosis based on observations to using studies and evidence-based medicine to make those diagnoses. So PTSD entered at that time. And we could see from the reason it entered, we could see slews of, large numbers of veterans returning from Vietnam with PTSD, really affecting the course of their lives. It wasn't just affecting them as they were in the moment of the trauma, but even lasted long after the trauma had occurred.
Is PTSD a dangerous psychological disorder or psychiatric disorder in the sense of harm to the patient?
Yeah, it puts you at risk for many complications throughout your life.
So, were some of those victims of Katrina, were they children with PTSD?
Yes.
And what were some of the recurring factors and things that you noted there?
You mean the symptoms that they would present with?
Yes, rudderless and...
Depression, anxiety, chronic medical conditions would exacerbate their PTSD as well. School absences, school failures, not being able to kind of continue on the natural course where you would expect a child to. And it was also stressful for the family to manage overall.
Now, you were referred at one point over to Maya Kowalski to care and treat for her?
Yes.
And I believe that came about when you and I met at a social function for our children, and I found out you were a pediatric psychiatrist and asked if you would help. Do you have your notes there before you so you can tell the jury the first time you saw Maya?
I do. The first time I saw her was October 27th, 2022.
And for the record, Judge, these are in at Trial Exhibit 2011-016 is the first one. The last page, I think, is 041. All right, so how did Maya Kowalski present?
So she initially came to me because she was having a resurgence of not doing so well. She was having more symptoms, flares of her symptoms of complex regional pain syndrome. And she was also reporting symptoms of depression, PTSD, anxiety, and a lot of problems with focus.
Now, to the best of your knowledge, had she been diagnosed with PTSD or depression prior to October 7th, 2016?
Not to my knowledge. So I only met with Maya and spoke with her father. I didn't review any of her previous records.
All right, and the date of this first visit was again?
October 27, 2022.
All right. And what, if anything, was significant in the history of Maya in terms of events in her life that you focused on in determining a probable or working diagnosis and treatment?
So, what she reported to me, which was relevant, and I can read directly from my notes, she said that with her complex regional pain syndrome, she felt alone and misunderstood. But she said after she was hospitalized at Johns Hopkins and her mother's suicide, she said, quote, it was a different kind of sadness. And so she was really struggling with.
How had she been doing up to the point that she saw you? Was she functional, non-functional?
She was somewhat functional, but not what I would consider to the best of her potential. She was doing online schooling. She was avoiding going to any doctor visits at all because she was very afraid of what would happen to her. And she reported significant symptoms of PTSD associated with physicians, hospitals, going to St. Petersburg. Just driving over the bridge made her feel anxious. She reported flashbacks about the hospitalization and general worries about her safety and her family's safety. And she also had withdrawn from activities that she had previously enjoyed doing prior to the hospitalization.
And did those include piano and skating and I forget the other one that she was involved in at the time?
Piano and skating she had
Piano.
withdrawn from. She said she was afraid to participate in ice skating. She said she was worried that if she got hurt, she'd have to go see a doctor or have to go to a hospital. And she also said that's why she didn't participate in any school sports.
Now, how strong were her, and then I want to go into the signs, symptoms under DSM-5 of PTSD and her symptoms.
Mm-hmm.
But how much was she able to sleep without taking any medications?
So that is one of the symptoms of depression and PTSD. She had reported to me that if she didn't take something for sleep, and at that time she was on a non-addictive sleep medication called trazodone, that it could take approximately 2 to 4 hours to fall asleep without it. And if she didn't take it, she was waking approximately 3 to 4 times a night.
All right, and so did she also have some additional, would you call these phobias?
No.
That she had? All right, but traveling over the, I guess, Sunshine Bridge, was that one that caused her anxiety?
Yes, I wouldn't characterize them as phobias. I would say they were intense fears that she had that kept her from doing what we would consider a person without PTSD to be able to do.
And had she become concerned in seeing any doctor that she did not feel safe with? In other words, that she hadn't gone to previously and knew?
Yes. She said that she would avoid going to St. Petersburg. She would avoid going across the bridge. If she heard a word or a phrase that had been used during her hospitalization, she felt very uncomfortable. She said she couldn't watch any movies that she watched in the hospital because they brought up negative memories. And a quote from her was, I would, quote, I would do anything to, quote, avoid seeing doctors.
Is avoidance a symptom of
Yes.
PTSD? So when you say she was hypervigilant about her safety, what does that mean?
So hypervigilance means like you are always on edge and worried about your safety. So a lot of people who have suffered from PTSD will say they like to sit in the back of the restaurant so they can see everything that's going on. So nothing can surprise them. That's an example of hypervigilance. You are just always kind of wound tight and on edge.
Fight or flight?
You're mostly feeling the flight.
Did it extend to even seeing people out in public that looked like some of the people she had dealt with at Johns Hopkins?
Yes.
Explain what happened there.
So that was in my notes from December 29th. That was my third visit with Maya. She had gotten a job at Cracker Barrel, and she told me that she saw a woman that looked like the social worker from the hospital named Kathy Beatty. And she said she felt, these are direct quotes from her, and I felt so scared I had to tell myself it was not her. She wanted to go home after that, leave her shift, but she said she was very afraid to explain that to her boss. She didn't know what to say. She said she felt a drop in her stomach, her heart was racing. She felt embarrassed because she was staring at the woman, really trying to figure out if it was Kathy Beatty or not. And she said she felt on edge for the rest of the night.
Did you first examine her before completely reviewing her prior medical records?
Yes.
And what is the purpose there?
I just wanted to form my own independent opinion without too much influence. I mean, I did know generally what had happened to her. And I didn't request the bulk of her medical records. She was just seeing me to have somebody to confide in, to receive some therapy. She was concerned herself about her focus. And she said she had tried everything that she could think of non-medication wise to address her anxiety and CRPS, but those things had not been working lately.
Was she displaying any, either at this point or in the future, any aversion to medications?
Yes.
What? Tell us about that.
She was comfortable with taking trazodone because she had been already taking that from her primary care doctor. She did agree to try one medication called gabapentin from me, but that took me over 2 sessions. Usually when I see somebody, they're open to taking medication because that's part of the reason that they're seeing me. But for Maya, it took a little bit longer to develop a rapport, form a relationship, gain her trust. I also spoke with her father as well. And after 2 or 3 sessions, they agreed to try the gabapentin, but she didn't have a good reaction to it and came off it a bit with my instructions, as I instructed her. But she didn't want to try another medication after that could potentially address depression and CRPS, some of the pain associated with it.
What, if anything, was significant in her past psychiatric history?
She was afraid that if she tried a new medication, which is what she told me, she was afraid that there could be repercussions like she had had previously.
And what was her fear in that regard?
She might have to get hospitalized.
And then what happens?
That she could get taken away from her family again, separated from her father and her brother.
And at this point she was being raised just by her father?
Correct.
Now, she had, I believe, had stated that she'd had a prior panic attack, but this was differentiated.
She reported having panic attacks in the past. They had improved somewhat, but she had a panic attack. She told me on 2 occasions when she found out that she'd have to, when the trial was delayed, and that she might have to undergo another deposition, and then when she...
Yeah, we can, we'll skip over that and
Okay.
get to the past medical history that was of some significance. If you look there, what was the main underlying diagnosis physically for this child?
Complex regional pain syndrome.
All right. And did she explain to you what the pain was about?
she described the nature of her pain. I did ask about it. She said she would feel a burning sensation, pins and needles pain, consistent with nerve pain, hot and cold in her extremities, weakness in her legs, and she described that a flare could last anywhere from 20 minutes to 24 hours. And she said years ago the pain could last for days. She did tell me that was on the first evaluation of Maya. She did tell me later on that she always feels, some days it can just go back to the baseline pain, which she said could be tolerable.
Now, you noted under some of the history that her mother had committed suicide. Can you tell the jury then, in this situation, if that is significant to your diagnosis and treatment, that her mother had committed suicide?
Yeah, so whenever we have a first-degree relative that's committed suicide, we consider that a risk factor for that patient as well, as a potential risk factor for suicide. For her, PTSD, any mental health diagnosis is also a risk factor, and I determined that she had major depressive disorder and PTSD, and having a chronic syndrome like complex regional pain syndrome is also a risk factor for things like suicide.
And then did you note in her history that for some periods here and there that she had been separated from her mother and her father for periods of time against her will?
That's what she reported to me, yes.
So then, after this first visit, what was your overall working diagnosis?
After this first visit, my diagnosis was major depressive disorder, recurrence, PTSD, chronic, and then I had put also rule out ADHD for her because she was having a lot of problems with focus and concentration at school.
Now, once you had completed your examination of her, did you have an opportunity then to look in her history to see, since all of this happened to her, if any other physicians, psychologists, psychiatrists had diagnosed her with PTSD?
After this initial visit?
Yes, when you went through the history, was there any indication that she had been diagnosed, says past diagnoses?
Not that I was aware of, no.
At page 23, at the under static risks, and then down under past psychiatric or above past psychiatric medications.
Yes, she had told me that, but I hadn't looked at it in any records.
Okay, so having gone through this now, let's talk a little bit about the signs, symptoms of PTSD, and what is DSM-5 now, if you could.
So DSM is the Diagnostic and Statistical Manual, and 5 means it's in its 5th revision. So it's in its 5th edition, essentially. And it's the manual that we use to diagnose psychiatric illnesses. For PTSD, you have to have exposure to a serious injury that is actual or threatened. It doesn't have to be somebody actually harming you. It can be a perceived threat. Or violence. You have to have direct exposure to a trauma. You have to have intrusive symptoms. You have to have avoidance symptoms. You have to have symptoms that are, they say, altered cognitions, like your perceptions of things are a little bit different. You see things a little bit differently. And then symptoms of arousal and reactivity, like hypervigilance. And so when you look at the symptoms of PTSD and the information that Maya provided me with, it matches with her symptoms.
And when you matched up what DSM-5 said as to the signs and symptoms of PTSD, what did you find? And in other words, when you compare your findings with Maya Kowalski with what, and is DSM-5 essentially the Bible then for psychologists, psychiatrists in diagnosing?
Yes.
All right, so when you combined looking at the signs and symptoms of DSM-5 PTSD and Maya's symptoms observed and reported, what were your findings?
That she had PTSD,
What was
according to the DSM criteria.
What was significant in terms of the signs and symptoms that matched up?
She had a trauma that she was forcibly separated from her parents. She had, so that was the direct trauma. She had symptoms of hypervigilance. She had avoidance, for sure. She would try to avoid doctors and going over to St. Petersburg as much as possible. She had intrusive thoughts. So she had described to me when she, like I said, when she would watch any movies at the hospital, or she had a box at home of things that she sometimes would run across from the hospital. Negative, intrusive flashbacks, nightmares, memories would occur. She had sleep disturbance. She had daytime flashbacks. And those were the bulk of her symptoms.
And so how many of these symptoms does a patient have to have before a diagnosis of PTSD can be made?
You have to have them for over a month and the timeline of the symptoms. And then you have to have, I always look at it, one or more of the intrusion symptoms, which she had the nightmares, she had the daytime flashbacks. You have to have one or more of the avoidance symptoms, which she did, avoiding doctors, avoiding going to St. Petersburg. And then you have to have two or more of the altered cognition, which is just a fancy way of saying, like, you're looking at things differently. So blaming yourself for what occurred, even though she wasn't directly related to the trauma, she felt very guilty for having been in the hospital and for her mother's suicide, which she was not responsible for either. Diminished interest or participation in significant activities, she definitely had that, so that was the altered cognitions. And then you have to have two or more of the hyperarousal criteria. So she had the hypervigilance and sleep disturbance for sure.
All right, having made the diagnosis then, what treatment did you prescribe, if any? Or what was the next step, if not?
Yeah, so the next step is talking with her dad just to confirm all of the information that I was seeing, that she described to me. He was also kind of seeing for her at home as well, and he did confirm that. And then talking about an overall plan, so I recommended therapy and medication.
So then, was she open to therapy at that point, or did she have barriers? Don't tell me what they are, but did she have barriers to that?
She did have barriers to going to therapy. She was not open to going to therapy. She said she had done it before, and the vast majority of people who do therapy are social workers, so she had some fears about going to see a social worker. We did have a psychologist at my former workplace that could have seen her, but she was hesitant about that, so she said she would consider it. Ultimately, she decided not to.
So did her father, Jack, confirm the symptoms that you had, the DSM-5 symptoms that you had initially identified?
Yes.
All right, and when was the next time that you saw her then?
So, the next time I saw her was December 1st, 2022.
All right, and so tell us what's going on then.
She had reported she had been having ups and downs in terms of her pain, because we always check in about that. The reason that I do that, and most psychiatrists do, the mind-body connection is very tight. So when you're doing something that makes you worried or anxious, you might have a stomach ache or a headache. And for her, with her CRPS, It could be a vicious cycle of her psychological state flaring up the CRPS symptoms. So we usually did check in about that, even though I wasn't treating her for her CRPS. So she said she was having some increased burning in her legs, more headaches, more leg weakness. She had tried to address that by going to the gym. She said schoolwork was very difficult for her. She mentioned anticipating the trial, and that was very upsetting to her. And she also talked about feeling guilty for being away from home. Her mother committed suicide in the home that she was living in, so she frequently was out of the house.
To the best of your knowledge, are the Kowalskis still living in that house?
As far as I know, yes.
All right. Now, can we look at, did you change any of the medications at this point? And what was her receptivity if you were trying?
So at this point, I had recommended the gabapentin. I took over prescribing the trazodone, which she said was a big relief for her. I took it over from her primary care doctor because she wouldn't have to go into his office then. And this was her primary care doctor she had had for a long time, and she liked him and trusted him. She had seen him before the hospitalization, as far as I know. But she still felt immense relief with not having to go into his office. So I took over prescribing the trazodone. She was going to start the gabapentin and was considering an antidepressant with her father. And I referred her for neuropsychological testing to see if we could clarify the diagnosis of ADHD that I had suspected.
Now, and did she undertake that neuropsychological testing?
I'm sorry, could you say that again?
Did she undergo neuropsychological testing then?
Not with our facility. I much later learned that she did do neuropsychological testing while she was at Johns Hopkins, but I didn't have those records at the time.
And so then you had said that the combination of CRPS and the PTSD created additional problems for her. Without getting into the CRPS side of it too much, but can you explain about how those two interact?
Yeah, it could, with any chronic illness, and particularly CRPS, when you are under stress, you are more likely to have a flare of that illness. I treated CRPS patients while I was at doing my fellowship at Stanford. I'd seen actually quite a few, and psychiatry was typically called in to see patients to help them manage the stress associated with having that chronic illness.
Then let's turn, I want to move a little as quick as we can given the time. And when was the next time you saw Maya?
The next time I saw her was December 29th, 2022.
And what happened there? It was the 27th or the 29th?
29th. She had tried the gabapentin and felt more depressed on it, and I told her if that had occurred, go ahead and stop the medication. There was no harm in abruptly stopping that medication. So she did, and she said it just took a while to feel like she was back to her normal self. Christmas had occurred. She said the holidays were hard without her mother, and the anniversary of her mother's suicide was coming up. She had reported feeling intermittent depression, and she had started working at Cracker Barrel, and that's when she saw the woman that looked like Kathy Beating.
Now, by this point, let's see how far are for me. Some 6 to 7 years, maybe 8 after the what happened to her at Johns Hopkins. By this time, had she made a friend who was a boy?
Yes.
And was that helpful for her?
Yes. She said she had a boyfriend, and he was nice to her, and she spent a lot of time out of the house, at his house with his family.
Now, did she describe to you throughout, as you got to know her more, that she was spending as much time as possible away from her home?
She did, and she had talked to me about feeling guilty about that. But I spoke with her father about that as well. She still had rules and boundaries around that. She still had a curfew. But her father was comfortable with it because he knew it was at times hard for her to be at home.
All right, let's jump ahead then to the next visit you had.
Mm-hmm.
And tell us what's going on there with Maya.
That next visit was January 25th, 2023. She told me, we had started on Ritalin for her ADHD.
Mm-hmm.
But she had also told me that she was sick prior to seeing me. But she waited till the very last minute to go to urgent care because she did not want to see a doctor. She said she felt a panic attack coming on when she went to see that doctor, even though the interaction was very brief. She said their interaction was maybe, she just said 2 minutes, but she felt the panic rising. Her heart was racing. She said she teared up. She felt short of breath. She felt intense fear. And again, she felt very embarrassed and guilty for feeling that way.
All right, and so then was she maintaining, getting better, getting worse? How did it appear to you at this point?
She was okay. Her pain had not improved substantially that she had described to me.
Did she describe that she had days when she would just lay in bed with pain 3 days or so?
She did. She said she had days where, when the pain was worse, she would primarily stay in bed all day. And when it was not as bad, she would do her online schoolwork.
Now, let's go to the next, if we could.
Oh,
Next visit.
she also mentioned to me
Yes.
that she felt like the job was not a good fit, and she was considering looking for another job. And as a psychiatrist, I felt like that was directly related to having run into people, having a fear of running into people, because just the month before she had ran into a woman that looked like Kathy Beatty. So she was considering leaving that job at that time.
And did it come to your attention that she in fact left that job soon thereafter?
After this session, Maya did not come back to see me.
Okay.
But I did learn that she did stop that job.
All right, so Maya then did not make the next session.
Correct.
And was there did she appear to be benefiting from the sessions?
She did. She seemed to be opening up more and more. She would always show up on time. We had developed a good rapport, and she was still considering therapy and potentially considering adding another medication, and she had scheduled the neuropsychological evaluation.
Did she have concerns over her psychiatric records being used against her at some point?
Objection, Your Honor.
What?
On the legal basis we discussed earlier.
That's not the question.
Foundation.
I'm going to sustain the objection.
Do you know why Maya was concerned over staying with her psychiatric treatment?
Same objection, Your Honor.
Sustain.
Okay. So now, how many times had you seen Maya?
I saw Maya 4 times.
And is this sufficient to make a diagnosis on this child?
Yes.
Do you have, and let's talk about depression, because I'd like to know what the DSM-5 criteria are for depression and the matchup, if you will, of the symptoms?
Sure. For a major depressive disorder, you have to have a feeling of hopelessness or helplessness or decreased interest in activities that you typically find enjoyment in for a period of 2 weeks or longer, combined with other symptoms. So insomnia, sleep disturbance, or sleeping too much, low energy levels typically, poor focus, poor motivation, decreased appetite, or for most of us, eating too much, and then what we call anhedonia, like I said, decreased interest in typical activities.
Well, did her symptoms match up to clinical depression?
Yes.
Now, do you have an opinion, based upon your background, training, and experience, and to a reasonable medical probability, as to whether Maya Kowalski suffers from post-traumatic stress disorder?
She does.
And do you have an opinion, based upon your background, training, and experience, and to a reasonable medical probability, whether Maya Kowalski suffers from chronic depression?
She does, in very much a way that we see adolescents express depression, intermittent chronic depression, yes.
Now, do you have an opinion, based upon your background, training, and experience, and to a reasonable medical probability, as to whether these diagnoses will cause or contribute to problems for Maya in the future?
Yes, they will.
Now, let's talk about, as Maya goes on, and follow up to that. Have you followed PTSD patients for
Yes.
before?
Yes, I have.
So, two questions. The first is, what is she at risk for? And then we'll talk about probabilities.
So with PTSD, she's at risk for difficulties with each of these diagnoses. One of the main things that's added in is that you have difficulty in your day-to-day functioning. So we all can experience depressive moments or some of these symptoms for short periods of time, but still function well. But she does have problems in her day-to-day functioning. So in the future, she can have problems with relationship formation and bonds. She can have trouble holding a job down and keeping it for an extended period of time. At her age, she should be applying to colleges. Not everybody does, but she certainly has the ability to.
Has she yet, to the best of your knowledge?
When I saw her, she was not, and she was not making any plans for the future. She said she didn't like to future plan because she felt like it was futile. That if you made future plans, they could get easily disrupted. And she's going to potentially have a lot of problems in terms of if she decides to have children in the future, the health care of those children and her own health care. She could potentially avoid doctors to the point where things that could be intervened and treated easily, that she does not go and get those things treated.
Do you have an opinion, based upon your background, training, and experience, and to a reasonable medical probability, as to whether the symptoms that you saw and from your experience following patients, whether Maya Kowalski's ability to earn money in the future will be diminished?
Objection. Lack of motivation, undisclosed opinion.
Can you approach, please?
Yes.
Objection is sustained.
Now, will Maya benefit from psychological care in the future?
Yes.
And what, if you could, from what you had recommended to her father and otherwise, would you recommend in terms of the care that Maya should receive if we can get her to go back?
Same objection, Ron.
That one she can answer.
I would recommend regular therapy and continued medication management. So regular therapy with a psychologist, probably not a social worker, and medication management with a child psychiatrist.
About how often?
Weekly therapy, and then medication management would just depend on how she's responding. So anywhere from weekly to monthly, it just depends.
Is there a basis in terms of an average from your background and training and experience for someone in Maya Kowalski's position with CRPS and the post-traumatic and depression aggravating it?
You mean a length of time that she would be in therapy?
I'm thinking more on average, how many times a year for this, if you can say. I mean, is it just 52? Like once
Same objection, Ron.
Overruled. You can answer that one.
Oh, yeah. So that all depends on, how she is doing in that therapy. But I have found that people with significant adverse childhood trauma. So when we think about childhood trauma, the effects of that tend to last throughout your life. And so she would need therapy on and off throughout her life, if not continuously.
Now, this type of trauma that she has, can you tell the jury how it affects the way Maya will view the world going forward?
Same objection, Ron.
Overruled. You can answer that.
So trauma generally kind of colors the way that you see the world. And so and I'm sure members of the jury have seen this, but I see it on a regular basis in terms of you kind of look at the world differently, a little more hostile, a little more frightening. And so it's going to affect how she views her world and interacts with people within it. And so it's going to be a lifetime struggle for her.
Is Maya given a Hobson's choice then about attending the treatment and having it cause her concern and not having the treatment and having her conditions get worse?
Object to the reading.
Going to sustain that objection.
What, if any, problems does Maya have between having are you aware that Maya Kowalski has had, and on at least 2 occasions, her CRPS activated by a psychiatric event?
Yes.
And so, in this situation, this interaction, can you explain to the jury the problems for Maya moving forward?
Not having her psychological issues treated could certainly worsen her CRPS symptoms because of that mind-body connection that I mentioned earlier. And so that could cause further impairment for her down the line physically as well.
Did you get a chance to review the neuropsychological testing that was done while she was at Johns Hopkins All Children's Hospital?
I did.
And was that performed by a Johns Hopkins doctor or a contractor?
It was performed by Dr. Lewis and my
Object to the foundation, Ron.
Sustained.
Is it true that with neuropsychological programs testing that it is the interpretation of the data that is more important than simply the data?
Yes, so the reason that I actually asked to look at the neuropsychological evaluation was because she did not get the neuropsychological evaluation done with us. And I wanted to see if my suspicion of ADHD was correct. So generally, a neuropsychological evaluation is when a neuropsychologist does certain tests to look at the way your brain processes information. So it can give you a lot of data. You get scores on certain testing, and then when you look at those scores, they fit a certain profile. So people with ADHD typically have a low processing speed and a low working memory, in contrast to their higher IQ. And for her IQ was extremely high. Her working memory numbers were low. Her processing speed was low. Combined with the clinical information that I had, that confirmed for me the diagnosis of ADHD. Dr. Lewis interpreted it differently, however.
And so then, as Maya grows older, this intersection of her CRPS and her depression and PTSD, will each, to the best of your knowledge, aggravate the other?
Yes.
Your witness. Subject property owner.
Good afternoon.
Good afternoon.
So, and I just wanted to ensure I understand this. You're up in the Jacksonville area?
Correct.
Okay. You've never seen Maya in person, correct?
I have not seen her in person.
And your involvement in this case is because Mr. Anderson asked you to become involved?
He asked me to see her as a patient, but said he would do his best to keep me out of coming to any court-involved proceedings.
Well,
And I was hoping that would be the case.
Well, I didn't call you here today, so don't be mad at me, but Mr. Anderson did. What is he paying you to be here today?
Standard rate
Which is what?
for testimonies can go is $600 per hour,
Okay, so, and
just for the testimony.
I understand. And so, in the connection with Mr. Anderson, so I understand you live in the same community as him?
I live in the same area,
Okay. And
not in the same
and your children used to go to school with his children, is that right?
Mm-hmm.
Yes?
Yes, sorry.
Okay.
I forgot I was on the microphone.
So let me talk to you a little bit about some of your evaluations with Maya.
Okay.
I'm going to just walk through. There's 4 appointments total, true?
Correct.
Okay, so let me start with the first one from a time period. It starts, the first appointment with Maya was over telehealth on October 27th, 2022, correct?
Correct.
Okay. You have a section called History of Present Illness.
That's right.
Okay. That's what the patient, being Maya, is telling you. Is that right?
Yes.
Okay.
I do also, so as I'm seeing patients, I'm typing because of the constraints of insurance, et cetera, and time, and having to see other patients. So I do add my interpretations in as I'm typing as well.
Okay. But in terms of what you typed into the record,
Mm-hmm.
on October 27th, 2022, you typed in, quote,
Objection.
I'll show her the record. Okay, I'll show her the record.
Yeah, well, why don't you show her as opposed to...
Sure. We're at trial exhibit. It's actually at Henschke 16.
Yes?
Let's not put it up. Are we just going to go hand it to her?
I have a copy.
Do you have a copy of it?
I do.
Okay, so I'll ask you. The first, halfway down the page, you see where it says patient's CRPS symptoms? We're in remission until 1 or 2 months ago.
I do?
Okay. And that's what you took in terms of a history from Maya on this day, that her symptoms were in remission until a month or 2 ago, correct?
Correct. And then later on, she did clarify she always feels that baseline pain.
Well, let me ask you about that. You said, and you ask about that in comparison to how she used to be before, because you took a history that said that a flare can last 20 minutes to 24 hours now, but years ago the pain used to last for days. True?
True.
And in other words, from her prior history, meaning before she went to All Children's Hospital, her CRPS was much worse than when you were seeing her now. True?
From what she said, yes.
Okay, so let me ask you about the next page.
But it's unclear to me why her symptoms improved.
Okay, and in fairness to you, I think you told this jury, you're not here to treat her CRPS.
Correct.
Okay, and in terms of what therapy or medications or lack of medications that Maya may have had after she got out of All Children's and what helped her improve, you're not here to tell the jury one way or the other. That's not your purview, correct?
Well, I can comment on her psychological state and
Right.
what
We'll
I
talk
think
about that.
improved that.
Witness, please answer the question, be allowed to answer the question.
Sure, I apologize. Go ahead.
Yeah, I can comment on her psychological state and what she reported to me and what I think improved that.
Okay. I was talking in terms of her physical symptoms, in terms of why her CRPS was in remission. That's not something that you are here to discuss, correct?
Not fully, except there is that mind-body connection, so that's why I always ask about her symptoms in
Got
my
it.
notes.
I think you told the jury you do have some experience with CRPS from your training,
Correct.
and you would agree that the treatment of CRPS includes psychological counseling, correct?
It does.
Okay. Let me ask you about some of your statements on the second page of your report.
Mm-hmm. Yes.
You took a history of medications. Do you see where it says current medications?
I do.
What medications was Maya on when she saw you on October 27th, 2022?
She was on trazodone
Okay.
and Claritin for allergies as needed.
Anything other than those two medications?
No.
Was there any significant family history in terms of psychiatric history that you recorded?
Maya reported to me that she thought her mother had depression, and she thought her brother had ADHD.
On the next page, you have it looks like you took a history, it looks like you did a review of her systems, is that right?
I did.
Okay. Under the constitutional section, well, first, what is constitutional?
How you look in general, just overall.
And what did you record?
Stable weight, and that she was in no acute distress.
Under the GI section, what is GI?
Gastrointestinal. So, review of systems, if I may,
Yes.
is required in all of our notes as psychiatrists as an insurance requirement. So we have to have a review of all your medical systems in addition to your psychiatric notes. So we look at, or we ask about, in the case of telemedicine since COVID, symptoms like related to your nose and throat, cardiovascular system, your heart, your lungs, your skeletal system, etc.
Right, and it probably was obvious, but sometimes I'm not as obvious as I should be. Since this is telehealth and you're not doing a hands-on assessment, you're relying on Maya to give you this information. True?
I am. I'm also constrained by time, so usually I get it in the history of present illness. Sometimes I don't always update it on my review of systems.
Okay. Well, what you
Like I
did
should.
record on your review of systems from GI, what was it?
No nausea, vomiting, diarrhea, or constipation.
Okay. What did you record on your review of systems for musculoskeletal?
No muscle, joint pain, or swelling, but I should have updated it to match my history of present illness.
In the integumentary, what is integumentary?
Skin.
What was reported to you regarding her skin?
No rash or cuts.
For example, if Maya told you I'm having lesions, that's where you would report it, true?
Correct.
In terms of neurologic, what did you record?
I put no dizziness or gait problems, but again, that was my error. I should have updated it to match the history of present illness.
Sorry, are you finished? I didn't mean to cut you off, I promise.
Oh, I didn't notice you cut me off because I was looking down. But
Okay.
it should have matched my history of present illness.
Okay. Maya did not report to any problems walking, did she?
Not at that time. She described in terms of neurologic, the burning sensation, the pins and needles pains, the hot and cold in her extremities, and her legs feeling weak.
But in terms of any difficulty walking, is that correct, that she didn't report to any difficulty walking?
Not at that time.
Okay. On the next page, you have your diagnoses. Do you see those?
On page 18,
It's actually on page 19. Did I skip a page on it?
I don't have a page 19.
Oh, I'm sorry. They're Bates marked at the bottom are yours, or you have your original records?
I'm
Yours
sorry.
aren't Bates marked. So
Yes, I have my regular records.
Gotcha. I'm looking at a series of diagnoses below the vitals in your electronic medical record. Do you see that?
Yes.
Okay. Are we on the same page?
Yes.
It looks like you have a diagnosis of depression. Is that right?
Correct.
You were asked by Mr. Anderson whether you were aware of any prior diagnoses of depression. You were not aware of any?
Not at that time that I saw her.
Okay. I'd like to show you what's in evidence, Joint Exhibit 1037-001.
Okay.
And this is an evidence?
It's a joint exhibit under your
Yes, it can be shown.
I'll represent to you this is a record from Eagles Wing Counseling dated November 9th, 2015. Under the DSM-5 diagnoses, it says...
Hang on, objection, and can we take this down and approach?
You may continue and you can redisplay the document.
Thank you. Do you see in this document that as of at least November 9th, 2015, there's a DSM-5 diagnosis code of depression/medical condition?
I see that.
Okay. Let me ask you about another document. Actually, I'm going to talk to you a little more about your report, so you can take that down. The next time that you saw Maya was for your second appointment on November 7th, 2022. I'm sorry, no, December 1st, 2022.
Yes,
Okay.
December 1st, 2022.
Again, this was telehealth.
Correct.
In the history of present illness section, you recorded that Maya, well, why don't you tell me what you reported in terms of whether she was having more or less of the burning pain?
She said she was having ups and downs with her pain. The week that I was seeing her, she said her pain had not been too bad, but the week prior, she said she was having increased burning pain in her legs. She had more headaches, and she also felt leg weakness.
Was Maya reporting to you whether she was able to work out on the treadmill?
Yeah, she said she had attempted to exercise on the treadmill.
Did Maya report to you whether she was able to do weight training?
Yep, she said she had done some weight training with, I remember this fairly vividly. She said just with her glutes. So she thought the machine where you exercised your glutes was hilarious. And that was the only weight training she had done.
Sure. And just a very general question. In your conversations with her, she was having a normal, healthy relationship with her boyfriend. True.
She described having a good relationship with her boyfriend. We did not get into the details so that I would classify it as normal.
Okay. And again, I don't want to pry any more than I need to in Maya's life on this, but from your basic conversation on this, her relationship with the boyfriend, there was nothing unusual to you.
Not that she noted.
Okay. On the next page, it says that. Sorry.
Right. It was a little unusual that she was actually at his home so much.
Okay.
I wouldn't say that is typical for a 16-year-old.
Got it. But in terms of her ability to form a relationship, that was, from your perspective as her counselor, normal with him.
Her doctor, as far as I know, but we hadn't gotten more to develop more of a rapport to really get into that just yet. But up to that point, as far as I knew, yes.
Okay. So as of December 1st, which is the date of this report, on the next page, according to her father and her, she was now working at Cracker Barrel.
That's correct.
Okay. Did she report any physical restrictions with her job at Cracker Barrel?
She did not.
In terms of her medications, which are listed on the same page, is it still the same too?
Correct.
Trazodone and Claritin? Okay.
Yes, sorry.
And just moving things along, the next page you again go through your review of systems, is that right?
That's correct.
What did you record for constitutional?
No acute distress, and that her weight was stable. This is a weight that she reported to me.
Okay. In terms of her skin, how was it?
She did not report any rash or cuts.
In terms of musculoskeletal, what did you record?
I reported no muscle or joint pain or swelling, but again, I should have updated to match my history of breast illness.
And this was in your plan, did you have any recommendations with regard to exercise?
Yes, I encourage her to try weightlifting in different forms and maybe seek out a female trainer potentially to work with at the gym.
And then for the next appointment, the 3rd of 4, this would be December 29th, 2022?
Yes.
Okay. The report here at the top, what did Maya report to you on her interview?
She said that she had a good Christmas with her family, that she asked for a nose piercing and a few more ear piercings.
Let me just ask you a question about that. Did Maya report to you any pain associated with either any of the piercings?
No, I didn't ask specifically though, and typically those cartilaginous parts of your body, you don't feel a lot of pain when you get those piercings.
Okay. In terms of her pain flares, were they better or worse?
She said she had had one significant pain flare where she was in bed for a day.
And for the other 29 days of the month, no reports, correct?
She said she continued to have that baseline pain.
Where does it say that?
So I asked her, does she always have pain? I can't remember which note it's in, but she said she always has a baseline pain. So
I got it. It's just not in this note, correct?
Correct.
This note does talk about Cracker Barrel waitressing now.
Yes.
Going on a little more than a month. How is that going?
She said she liked it overall, but she didn't like the shift leader on Mondays because she had yelled at her. She was stressed about going to work on Mondays. So we talked about maybe rearranging her schedule so she didn't have to encounter that shift leader. And she also told me that was one of those days when she was at work. She had served a woman who looked very much like the social worker from the hospital, Kathy Beatty.
Did Maya report to any physical restrictions at work?
She did not.
In terms of medications, it looks like you started Ritalin, is that correct?
At the end of that visit. So, yes, I had started the Ritalin. So, ADHD is a clinical diagnosis, meaning you can make the diagnosis based on the symptoms that the person is reporting to you. And since she hadn't gotten the neuropsych testing done and was still reporting a lot of struggles with focus and concentration, we decided to go ahead and start the Ritalin.
And the Ritalin was for the ADHD?
Mm-hmm.
Yes? I'm sorry.
Yes, I'm sorry.
You're okay. Again, on this, you do a review of systems. How is Maya doing in terms of her reported systems?
The same in terms of what I documented. Again, I should have updated my review of systems to match with the history of present illness.
What you have documented here is no acute distress, correct?
Correct.
And what you have documented here is no nausea, vomiting, diarrhea, or constipation, correct?
Correct.
And what you have documented here is on skin, no rashes or cuts, correct?
Correct.
And what you have documented here is no muscle or joint pain or swelling, correct?
Correct.
Let me talk to you a little bit about, you mentioned a diagnosis of PTSD.
Yes.
You did mention that you reviewed a report from Dr. Lewis. Is that right?
Yes, I reviewed that after Maya stopped seeing me.
Okay. Did you see in Dr. Lewis's report that Maya reported severe anxiety and depressive response when learning that the ketamine infusion in Mexico had a 50% chance of killing me and cost my parents so much money?
I did see that.
Okay. Did you also see in the report that Maya presented with evidence of extensive clinical interview evidence of DSM-5 adjustment disorder with mixed anxiety and depressed mood, moderate to severe?
I did, but I found Dr. Lewis's report. I was concerned about it because it had, in my opinion, a lot of confirmation bias associated with it, meaning he was highlighting symptoms that were reported to him from the primary team associated with Munchausen's. He was highlighting sort of a lot of those concerns, and he even mentioned that she could have a history of ADHD. She could have ADHD based on her scores, but that she had no clinical manifestations of ADHD, but he had not interviewed her parents. He hadn't interviewed any of her, or done any rating scales with them, or done any rating scales with her teachers.
But you agreed with the diagnosis of ADHD eventually, correct?
Yeah, he didn't make the diagnosis of ADHD, though. He overlooked it.
Okay. You found ADHD in addition. But in terms of his comment that, well, it wasn't his comment. According to his report, Maya told him that she had anxiety and depressive response when discussing the ketamine coma that the jury saw earlier today, correct?
He did report that.
In terms of your last report, your last visit on, I guess, pull it up. The last time you saw Maya was on January 25th, 2023.
That's correct.
Was the Ritalin helping?
She said it was. With her focus and attention, with specifically with school and being able to get homework done.
Was she still working at Cracker Barrel?
She was, but she was considering leaving that job because she didn't feel like it was a good fit.
Okay. And just in terms of a time frame, this is about 2.5 months at least that she's been working at Cracker Barrel?
Approximately, yes.
Okay. And then in terms of your review of systems, any change from Well, let me just walk you through it real briefly, doctor. Constitutional, did you record any acute distress?
No acute distress.
How about her gastrointestinal exam?
Oh, I did record that she had lost about 5 pounds, but no acute distress. Gastrointestinal, no nausea, vomiting, diarrhea, or constipation.
Musculoskeletal, what did you find?
No muscle, joint pain, or swelling.
Integumentary skin, what did you find?
No rash or cuts.
One moment, Your Honor.
Yes, sir.
I appreciate your time today. Thank you.
Redirect, Mr. Anderson.
Thank you. I can find it. In that report from Eagles Wings, do you note the date?
Could you say that one more time, please?
The Eagles Wing counseling report, where it said she had some depression, did you note the date?
I saw the year. It was 2015.
Mm-hmm. And from the history that Maya gave you, did that appear to be right in the middle of her first go-round with CRPS and immediately prior to going to Mexico for the ketamine procedure?
As far as I know, yes. She also, the way that the therapist coded it, she coded it as depression and anxiety secondary to a medical condition. So it was her view from the diagnosis that the depression and anxiety was associated with the CRPS.
Now, can you distinguish that kind of diagnosis from your diagnosis of chronic depression and PTSD? Is this more situational?
Based on what I saw that came up on the screen, yes. And so I saw her many years later, and my diagnosis was that her depression was somewhat independent of her CRPS. They are tied together, but I chose that diagnosis. And then the PTSD was directly related to the stay at Hopkins.
Your diagnosis of ADHD, can you tell the jury whether that is a major finding or is that I don't know what you call it.
We call it an incidental finding. But that is the reason, Maya wasn't in general comfortable seeing doctors, but she was having so much trouble with her focus. That is why she decided to see me. And so I did want to focus on what she wanted to address as well. You can't just kind of willy-nilly do what you want as a doctor. You have to focus on what the patient would like to address too. So we did address her focus and attention as well.
So the ADHD is not a connected, pre-existing or any condition that affects the PTSD or chronic depression?
Not in particular, no. I just had brought it back to Dr. Lewis's report because I found that his overlooking of that diagnosis, especially associated with the numbers, was concerning based on the report I read.
Thank you.
Any further follow-up?
No, Your Honor, thank you.
Members of the jury, do any of you have any questions? Ask the attorney to approach, please.
Members of the jury, if I could have you go out for just a couple of moments. This will be very quick. Do not discuss this case amongst yourselves. Do not do any investigation and receive no information.
All right, jurors exiting.
Okay, the jury's out of the question. Is it okay if I ask both those two questions? Please, go ahead. Okay. Doctor,
Yes.
want to hear what your answer is going to be to the following two questions.
Okay.
If your recommendation for Maya's treatment is weekly therapy sessions due to her intense childhood trauma, why were your sessions with Maya only held monthly?
Because mine focused primarily on medication management, and I did some supportive therapy, but I felt like she needed separate sessions with the therapist, and she had declined.
Okay, next question. Why hasn't Maya been seen by you since January 25, 2023?
Once she found out my records would be subpoenaed, she stopped seeing me.
Can I see the attorneys real quick?
Can we,
Wasn't certain that they were going to be.
Okay, thank you. On that last question about why hasn't Maya been seen since January 25th, 2023,
Yes.
if you could answer it just the way you answered it to me, to the jury, without further explanation or embellishment. Can you do that?
I can do that.
Okay, thank you very much. Let's bring back the jury. Okay, everyone, let's please be seated. Members of the jury, I want to confirm that since you were away 3 minutes ago, you did not discuss this case amongst yourselves, did not do any investigation, and received no information. Is that correct?
That's correct.
And you've not seen any media reports?
No.
And no one's approached you. Is that correct? Okay. Doctor, the jury has some questions. I'm going to just kind of go through them one at a time. Doctor, I believe you mentioned while at a hospital you were often requested to help a patient cope with CRPS. This would assume a patient had or was diagnosed with CRPS already by a prior doctor. Have you ever been summoned to observe a patient to either confirm or disprove a patient has CRPS symptoms?
That's a good question. No, I was typically consulted once the diagnosis was already made by a neurologist.
Okay. Now, the next question. What percentage of females 18 to 25 are diagnosed with depression or generalized anxiety?
If we're looking in the U.S., what percentage? Or what percentage of my
It
patients?
says what percentage of females 18 to 25. The question doesn't say whether in the U.S. or in your practice, so why don't you give us the U.S. if you know it?
I would just be ballparking it in the U.S. I haven't looked at those statistics for a while. I would probably say maybe 60 to 70%. I would have to double check that, though.
Okay. Though Maya's situation is tragic and unique, the diagnosis is no longer uncommon, and that's the CRPS, the depression diagnosis. Is that correct?
Oh, could you repeat that one more time, please?
Though Maya's situation is tragic and unique, the diagnosis is no longer uncommon.
Of depression?
And I think it's depression and generalized anxiety is what the question was asking.
No, I wouldn't. Yes, they're no longer uncommon.
And how common is adult ADHD versus pediatric ADHD?
Oh, that one's a harder question to answer. We don't have a lot of studies comparing both of those. So it has to do with also kind of social influences too. So there are a lot of adults that have went undiagnosed as children. So it depends on what generation we're looking at as well, like what percentage between the two. So it would just depend on the age.
Okay. The next question, if your recommendation for Maya's treatment is weekly therapy sessions due to her intense childhood trauma, why were your sessions with Maya only held monthly?
Also a good question. So there are not a lot of child psychiatrists in the country. And the bulk of my time is taken up doing medication management. So the way that we do the model now, as opposed to many, many years ago, is that the psychiatrist will do the medication management portion, and we'll have a licensed therapist, that can be a psychologist, a social worker, a licensed mental health counselor, to do the therapy portion. So I was seeing her for the medication management piece, and did encourage her to start therapy. She was very hesitant to start therapy.
And the last question, why hasn't Maya been seen by you since January 25, 2023?
Once she found out my records might be subpoenaed, she stopped seeing me.
Mr. Anderson, any further questions?
The depression, the generalized anxiety depression that so many women from 18 to 25 have, can you explain the difference between the event-specific depression that Maya Kowalski has?
Yeah, it's hard to untangle her major depressive disorder from her PTSD. So both really do go together. And with that diagnosis, it has to impact her functioning in daily life. And so her daily functioning is impacted in terms of her depressive episodes, her intermittent depressive episodes. She'll miss school, she'll withdraw from activities, she won't do the things that you envision a typical 16-year-old doing.
I guess the question is, but for this event, would Maya have had generalized anxiety and depression, in your view, if she had just been raised without this kind of trauma? At least the type of depression that they're considering.
Speculation, lack of foundation.
I think you're starting again, aren't you?
I'll start it again.
Thank you.
Again, was this depression of a generalized nature, or was it event specific?
Objection, speculation, lack of foundation.
Overruled. You can answer.
As Maya reported it to me, it was event specific and tied to the stay at Hopkins, and that is what she reported to me.
So, one of the jurors wanted to know about whether you had investigated CRPS as part of the diagnosis process. Can you explain to the jury what secondary gain is?
Yeah, objection. Far outside the scope of question.
No, it's not. It's exactly on the point.
Sustained.
Did Maya exhibit any signs of trying to misrepresent, exaggerate, or otherwise portray her symptoms, either from CRPS or psychologically, falsely to you?
Same objection there.
Overruled. She can answer that one.
No, she did not.
Are your questions and the way that you handle a patient designed to seek out and determine whether some type of falsification or exaggeration or other reason is embedded in their answers?
Same objection, Your Honor.
Overruled. You can answer.
So typically that comes with experience, and I've been seeing children and adolescents and adults for a very long time, and it can become apparent when people are embellishing their symptoms, even if it's part of a disorder that they have. Her reports to me did not seem embellished or enhanced in any way.
Thank you, Doctor.
Mr. Shapiro, anything further?
I do not, Your Honor. Thank you.
Okay. Any further from the jury? Okay. Members of the jury, going to throw you a little curveball here. You're going to get to sleep in 15 more minutes. So it's a slight curveball. I'm going to ask that you be at the rallying point 15 minutes later. I want you to be coming through the door, Deputy Coley, at 9:15 tomorrow. As always, do not discuss this case amongst yourselves. Do not do any investigation and receive no information. Have a wonderful evening. Presence. Doctor, do you mind having a seat? Are we still doing a proffer? And Doctor, what's happening is there's some things that I've not allowed to go to the jury that Mr. Anderson wants to put on the record. So he's going to ask you a series of questions, and then there might be a series of additional questions.
Okay.
Hopefully, it won't be very long. Is that correct, Mr. Anderson?
Yes, Your Honor, I'm looking for the non-redacted. All of these. There it is. We have these marked for identification. And for the record, this is a comprehensive med psych systems records of Jacqueline Henschke.
What we need to
Unredacted.
do is make it probably the next number in the defense or in the plaintiff series so that we don't get confused.
Well, Your Honor, on that point, our list continues from 2001 to 2787. Can we make it 2800 or 2801? Just to,
2800?
sure.
So says the clerk, 2,800.
May I please the court? Or are we still?
You can proceed, and just so the transcript is clear, this is the proffer. The jury is not in our presence.
I'm sorry, Your Honor, 2,800 was received.
Is not received. It's
not
just being marked for identification purposes.
Thank you.
In Exhibit 2800, and let me preface this by saying that in this proffer you are not restricted in what you can say
Okay.
as to these certain facts. But in Exhibit 2800, you had recorded certain things that happened to Maya. First off, can you tell us how that came about and the first time you knew of them?
Yeah, so whenever I do an evaluation, I always, especially the initial evaluation, I always ask about any physical or sexual abuse. And under physical abuse, Maya reported, under abuse/trauma history, Maya reported under physical that the social worker at the hospital physically grabbed her while at Johns Hopkins, and she experienced unwanted touching under the guise of an examination. I documented that patient also notes that a doctor came into her room and said, quote, "Could I look?" And I did not say yes, and he pulled down my pants and pulled them back up and did not say anything, unquote.
And did she discuss these events with you through the course of the treatment?
She did.
And did they cause her great anxiety or other psychological injury?
Yes. She said that, as far as I can recall, she was not on any birth control and had not seen an obstetrician or a gynecologist for that reason, which typically at age 16, you would see a young girl going to see an OB-GYN. So she did say she felt traumatized from that incident.
So how old was she at this point? Did she make that clear?
She was 16. Oh, when that occurred?
Yes.
When she was in the hospital, when she was 10.
So that would have been when she was approximately 10
Yes.
to 11. And this particular entry there, did Maya give you any reason why she had failed to come forward between the time that this occurred and this visit with you?
No, I did not ask her, though. I didn't. I just was taking down the information. So it was not, I did not know that she had not reported that anywhere else.
And so you and I, in any of the phone calls we had, we did not discuss it either, did we?
No.
And so can you tell the court a bit about repression of these types of events in girls that age, that is 9, 10, 11, prepubescent?
She certainly, Maya described to me in one of my notes, it might have been the first one, that she really didn't like to express emotion. She did not like to see have people see her cry. She did not like to express any kind of emotion around others. And so I can only imagine that, like everything else, she felt very embarrassed about the situation that had occurred if she had not mentioned it to anyone else.
And in psychiatric terms, what happened to her? What type of sexual injury, or what is the label for what happened to her?
We would call it battery or assault without, I mean, I don't know what the legal term is, but that's what I would call it, without asking for her permission or telling her what was going to happen. Whenever you do an examination as a physician of somebody's genital areas, you should let them know what you're going to do before you do it, why you are doing it, and what the outcome of the exam is, even if it's in a young child.
Was there any reason, assuming it was a doctor at Johns Hopkins, is there any reason why a male doctor would come into a 10-year-old girl's room alone and examine her vaginal area?
Objection foundation.
Overruled. She can answer the question in the proffer.
I cannot think of any reason why.
And so, having heard this now, is this a reportable incident in terms of to the state, given the manner in which it was reported to you, and leaving aside any statute of limitations issues?
It is reportable. She could not recall the name of the doctor, because I usually ask those things in order to make a report. So as far as I know, she could not recall who it was.
Assuming that she could report this battery of a sexual nature at Johns Hopkins, would it significantly increase the knowledge of the jury as to why many of her symptoms have occurred?
Objection calls for a legal conclusion, lack of foundation, speculation.
Doctor, you can answer the question.
I think it would be appropriate for the jury to know what she experienced while she was in the hospital, and that's part of what she experienced. That was part of her trauma.
Thank you, Doctor.
Mr. Shapiro, would you like to ask any questions in proffer?
Just very briefly in proffer, Your Honor. Your note does not say this happened at all children's, correct?
She said while at Johns Hopkins.
Well, the previous note says that the social worker incident was at Johns Hopkins, but this note does not say it happened at Johns Hopkins, correct?
No, that all means it happened at Johns Hopkins.
And you, as a mandatory reporter, were told about an assault at Johns Hopkins that you thought was sexual in nature and you failed to report it?
I am a mandated reporter, but when I call Department of Children and Family Services, if I don't have a name, they can't take the report.
And you can't, you're telling me that you had this information about it and you didn't think that you had an obligation to report it at the time, is that right?
I didn't have a name to report.
Anything further?
But you did make a call?
To Child and Family Services, I did not make a call because I didn't have a name to report.
It was not described as a social worker that committed this act. Did Maya have a fairly specific description of who it was for you?
She did not. She just said a doctor came into her room.
From the way she was telling the story, did it appear to be male or female?
She indicated that it was a male doctor because she said he pulled down my pants.
And did she say anything else to describe him?
No.
Nothing further at this time, Your Honor.
Very briefly. Is what you've written here the full description of what was reported to you?
Yes.
Sorry, one other question. At the time, assuming for the purpose of this, that a Dr. Katzenstein at the hospital had a similar note back during Maya's actual stay in the fall of, however you want to phrase it, in the fall of 2016, would Dr. Katzenstein, as a psychologist, be required to report this?
Yes. We are all mandated reporters. Psychologists, psychiatrists.
So is it a violation of the law for a mandatory reporter to receive a report like this and fail to call the state and let it be known that at least there is a basis for looking into it in some way?
Well, object calls for a legal conclusion.
I'm going to sustain that.
Right. And at that time, at approximately the same time it happened, would Dr. Katzenstein have been in a better position than you some, 6, 7 years later to identify who perhaps it was and more details of the event?
Objection, lack of foundation, completely misstates Dr. Katzenstein's
Sustained.
note.
Was Dr. Katzenstein a psychologist at Johns Hopkins All Children's Hospital, best to your knowledge?
As far as I know.
And as a psychologist there at the time, is it easier in terms of if you can get a child to talk about it, to obtain more fact
Objection
closer
calls
to
for
the event?
speculation.
Yes.
Not
You
specific.
can answer the question.
Yes. It would have been easier for Dr. Katzenstein to obtain more detailed information and to make the report, and more accurate.
Thank you, Doctor.
Based on those questions. Doctor, have you seen Dr. Katzenstein's note?
I have not.
You have, in fairness to you, you have no idea what she recorded, correct?
I do not.
And you are unaware that her testimony on this is going to be that this incident that you described did not happen at All Children's Hospital, correct?
Could you ask that one more time, please?
You're not aware, as you're testifying here today, what Dr. Katzenstein is going to testify on regarding where this incident happened, correct?
I am not aware, no.
And so you're not aware that Dr. Katzenstein is going to testify that this happened, what Maya reported to her did not happen at All Children's Hospital, correct?
Objection, Your Honor, for improper for Crawford.
She's already said she doesn't know,
Okay.
so.
I'm not aware.
Yeah, are you aware of any similar incident occurring in the Lurie's Children's Hospital record?
No.
Okay. That's all, thank you.
May the witness be excused?
Are we finished with the proffer first? Are we finished with the proffer?
Call up very quickly Dr. Katzenstein's note to show the doctor.
She hasn't seen.
Mr. Anderson, she's already said she didn't see the note. So what's the point at this point?
I wanted to make sure that the doctor saw the note to see exactly what the terminology was used at that time on, I think it was.
She's already said she hasn't seen the note, so I think we have exhausted her knowledge on the subject. So we're not pulling up someone else's note. Is there anything else, though, you want in the proffer?
I'm zipping up my binder.
So that's a no. Your proffer's over. Is that correct?
My proffer's complete, given the court's ruling.
Nothing further, Your Honor.
So the transcript is complete. This concludes the proffer. And now may this doctor be excused, or does she need to remain under subpoena?
I don't know. I think we're going to keep her under subpoena for a little while, Judge.
Okay, doctor, you're welcome to go back to Jacksonville. If they need to call you back, I'm sure they will call you and talk to you about that. But because you're still under the subpoena, please do not talk about the case with anyone other than the attorneys in this matter.
Okay.
Okay? Thank you for being here, doctor, and have a safe drive back.
Thank you.
Okay, while she is leaving, let's talk our logistics so we can get out of here ourselves.
Yes, Judge. We've been considering how to make this trial operate a lot faster and thank you, Doctor, a lot easier for the jury. And we would like to request that tomorrow afternoon, could we have some hearing time later on in the day? The other reason is, given the events, I would like to get out of here and go see my family a bit early, leave a bit earlier than 6 o'clock. And so we were hoping that tomorrow we could call a few witnesses, show a few depositions, and then have at least an hour to, how long? 2 hours to go over these exhibits, clean all this up, and make sure that this trial goes smoothly. It also assists us in how many questions we're going to ask and what kind of questions we're going to ask if we know what's in evidence and what does not.
Who do you want to call tomorrow? And let's talk time.
Tomorrow morning, we plan to play 2 depositions, Rebecca Johnson and Catherine Beatty.
How much time is each at this point?
These 2 volumes. Volume 1 is 33 minutes. Volume 2 is 45 minutes. And Rebecca Johnson.
So Catherine Beatty's 1 hour and 15 minutes approximately.
And then, just a moment. Rebecca Johnson's video, as edited by the defense team, is 1 hour 9 minutes.
And 1 hour, 9 minutes, Your Honor, for Rebecca Johnson.
And do you anticipate needing any exhibits coming in tomorrow for that?
Not for that, Your Honor. We have 2 live witnesses. Who was on the list that we put? Elena Kushner. Elena Kushner, Judge, is a similar incident, similar event planned under that 404. And we want to call her to testify that she had an experience at Johns Hopkins, not only substantially similar, virtually identical to my clients. And so we would wish to call her, in other words, Sally Smith coming in, undisclosed as working for someone other than Johns Hopkins.
So this is, you're basically asking for like Williams rule type of testimony. Have you filed a motion to that effect?
Judge,
That's
you've
for-
already
that's for
granted an
criminal-
order
I thought that
on
was
a
for
motion
criminal
on limine
proceedings,
that
Judge.
this would not, testimony would not be allowed.
Well, I do remember that.
Right.
Well, I took a look and I thought that the Williams rule, it applied, the notice is applicable to criminal cases, and this is purely civil.
Well, you're right that Williams rule is a criminal-based rule, but you still have to give notice. And I've already ruled that what happened to other people at other times and in other circumstances is not relevant in this particular case. Just like,
Well, we have a pending punitive damages count or open allegation, Judge. And so our ability to establish the facts for that is greatly enhanced if we can show that the defendant is acting consistently to that conduct in other ways. And so our problem here is
you're
that
going to need a lot more legal discussion about whether this witness is going to be allowed. And, this is one of those that you probably need case law and very specific motion. This isn't a just let's talk about it and let it happen.
I suspected there would be a proffer for it, but we can file a motion if the court so
If you want to do a proffer, that's fine, but I'm asking about witnesses who are actually going to be testifying to the jury.
Yes, Judge, my contemplation was that on all of these witnesses, there would have to be a proffer before they would be allowed to testify to the jury so the court can see whether the scope of the testimony falls within the law. So if you want us to brief it, we can brief it.
On that particular issue, sure, because I've already ruled that evidence like this can't come in, so I really would feel uncomfortable without some sort of actual motion and case law to articulate exactly what you're doing and why you're legally allowed to do what you're proposing to do.
Yes, Your Honor.
So that's Elena who?
Say again.
That was Elena Brown? Kushner.
And so other than those 2 depositions, Mr. Anderson, are you planning on calling anyone live tomorrow?
Let me look for just a moment. There are no major witnesses, let's put it that way. These are
Any minor ones?
So, we request hearing time in the afternoon. Those 2 depositions will fill up the majority of the morning. Pending the court's decision on hearing time, we would also potentially call Joyce Sacco, Tammy, I think you say Special, it's Speceyal, and Deborah Salisbury, if we had to fill out the day. But we prefer to have hearing time. And the reason for that, Your Honor, is that we anticipate calling Maya Kowalski early next week. And we don't believe that the 30 minutes or 45 minutes that the court has been allowing us in the mornings is going to be sufficient given the number of objections. For all of the exhibits we'd like to bring in through Maya Kowalski. So we'd like some additional time tomorrow afternoon to work through that process so that we can call her early next week.
So again, I would just ask, you threw out several names, who are the plaintiffs?
Let me ask this. Why don't we do this? And this is not a ruling, this is just to throw it out there. I'm not having the jury start until 9:15. The earliest that I can start with you all tomorrow is 8:45. That's the earliest I can start with you tomorrow. If we don't need to do exhibits in the morning, perhaps you all could come at 9 and the jury start at 9:15. We do the 2 depositions. We send the jury home. We go to lunch, come back, and address issues. If we need to take proffers, we can take proffers. And that way you don't have to worry about live witnesses in the afternoon. And it also allows you to, and I told you earlier, whatever you're going to need to do, we'll accommodate and make it work. So I'm happy to do that if that is good for both sides.
Yes, the defense has no objection to that, but so neither Mr. Hunter, Ms. Crowles, or I are up preparing late. It sounds like there will be no live witnesses tomorrow.
On that basis, we'll follow the judge's suggestion, and you don't have live witnesses, you'll just have to sit through depots.
Now, let's talk about the legal issues so Mr. Altenburn and Mr. Elegant have an idea as to what we're talking about.
I have one legal issue. We have a pending motion to admit child abuse hearsay we'd like to be taken up tomorrow afternoon. You asked for it.
Well, we'll talk about whether we're going to take it up. But we'll talk about the motion.
Are you wanting more of a indication of what their proffers are about? I mean, I'm not too sure what this anecdotal evidence they're describing is going to be.
Well, they can do whatever they want in proffer. I'm trying to figure out what the legal issues are. One, so I've got an idea so I can think about it tonight. Two, that all the lawyers can be thinking about it tonight, especially since you're not having to prepare for a witness tomorrow. Because I know you also probably want to sleep tonight as well.
The damage is if this is something that occurred prior to our events and that John Hopkins was found liable for, so that they were on notice to change, that might be relevant to punitive events, but I get the sense that that's not what this is about.
Judge, what I'm hearing is that they have a lot of exhibits that they want to use with Maya, and there's probably objection, in all candor, with most of them. And I think that that's, if I heard right, is the primary focus of what you want to deal with tomorrow. Is that accurate?
That is accurate.
That's correct.
And a lot of them are audio recordings that we are objecting to, and there's, I think, multiple issues with them. So I think that's the focus.
I'm fine, although I know Mr. Altenburn has been trying to get to the front of the line for several days.
I'm happy to go behind.
The limiting instruction shouldn't take too much time. I don't think the rule issue will take too much time.
And Mr. Altenburn, we can talk about this more tomorrow, but I'm starting to want to really start focusing in on the verdict form and the jury instructions.
Judge, we would like the jury instructed sooner rather than later regarding the limitation of some of the evidence that has come in that were let in on state of the mind.
And what we can do, and my hope is that you'll have whatever you're proposing tomorrow so we can talk about it tomorrow afternoon.
Okay.
So to recap, you all will appear tomorrow at 9 a.m., not at 8:30, at 9 a.m. We're going to play 2 depots, and we're going to send the jury home. We'll take a lunch, and we'll come back. We'll do exhibits. We'll talk about whether we're going to talk about the child victim hearsay. We're going to talk about Mr. Altenburn's instructions and any other instructions that anyone wants to write out. And of course, Mr. Anderson's free to go whenever he wants and or needs to.
Thank you, Your Honor.
Okay? Are we good to go at this point?
Do you have a shot clock update?
Oh, yes. Okay, plaintiffs today, 3 hours, 50 minutes. Defendant, 1 hour, 35 minutes. The plaintiffs are at 24 hours, 25 minutes. The defendants are at 8 hours, 10 minutes.
How much time have the jury
Yeah, how much does the jury get?
Well, that's a fair question. What I've been doing is when we are at sidebar talking about it, I have not been attributing that time to anybody. And then, let's say the jury is 10 minutes of actual me asking questions. I'm just dividing it 5 minutes, 5 minutes. I'm just doing that 50-50.
I've never seen a transcript that had this many jury questions. Not even close.
Well, I will tell you, Justice Wells used to say, can't say that I have not seen it all because I surely haven't. Okay. And no one wanted to tell me what the score of the Rays game was? Okay, it doesn't matter. Have a good night. We'll be in recess.
waxed last night.